More information on all these things will be coming up as the other presentations are founded. As I was health and safety, if you read the Maui news today, you'll see that we're no longer the worst in the United States for homelessness. Right. New York took us, we had the #1 spot. We lost it now, thank God. New York's taken the #1 spot. Well, we're #2. But still, that's pretty bad, isn't it? #2, the worst, second worst in the United States per capita with homelessness as a situation. That's another thing we don't want to be happy and proud of, but we're really glad that the state has declared it a crisis. There's working programs in Wailuku, the SAFE program, and that can be implemented here. And there's great organizations committed to making that number go down even more. Health and safety has been one of the biggest things. Our isolation here in West Maui has brought us into such unique problems and challenges that are unparalleled anywhere else, where you have a multi-billion-dollar community isolated on a one-way street. It just doesn't happen anywhere. And what does that create? A lot of opportunities for issues that you wouldn't think should be possible. And people are shocked when they find out, you don't have a hospital here? There's only one on the other side? Oh my God, what are we gonna do about that? So after we got done building the fire and ambulance station, they said, well, what's next? You gotta get a hospital. So we've been working forever, seems like the last 20-some years. They said you'll never get a certificate of need. We did. And then now for financial reasons, the developer's not gonna do that. But, when God closes one door, another one opens up. And I'm thinking maybe all this had to do with what should have been opened, and the reason why that didn't happen is because something even better is envisioned for us, and that could be a freestanding emergency room here, owned and operated and staffed by emergency room physicians, board certified, and part of the existing Maui Health Systems, our new hospital in Wailuku, which is by far so much better than it was years ago. Let me just tell you, they've done an awesome job. And representing them today and talking about that with more than I know is going to be Jim Deagle, the Chief Strategy Officer. I've met with Jim and Mike Rembus and Lee Weiss, who's in charge of emergency medicine. They got me so excited about meeting with them and what they believe they can do for us. And I'm not going to take any more of their thunder away. Please join me in welcoming Chief Strategy Officer for Maui Health Systems, Jim Deagle.
This side? Aloha koko. Is Rick Nava here? I don't see Rick. He came in for a few minutes ago and that. Anyway, thank you for allowing me an opportunity to spend a few minutes with you this evening. I'm here on behalf of Mike Rembus, the CEO of Maui Health. Mike has been in his position for about 2.5 years now. Senator Baker, Mike asked me to extend his hello to you as well. So I know Mike from 31 years ago. So when Mike was a young CEO in Southern California, I was coming out of my training program and actually trained under him for 1.5 years before I went off and had my own career in hospitals and health systems, both in the international market, rural markets, domestic, et cetera. And so my career spanned time in the Marshall Islands, Washington State, California, 25 years in Oregon. And then prior to coming to Maui 7 months ago, I spent 3 years in Washington, D.C. And so I've been kind of bouncing around a little bit, but bring kind of a unique perspective to healthcare. And when Mike heard that I had returned from D.C. Back to Oregon, from Central Oregon, he called and said, so what's your excuse now not coming to work for me? And that didn't take very long to convince me to come here. So my wife and I are here. We just bought a small home in Wailuku. We're domiciled here in Hawaii, and I'm here for the long term to work specifically with Mike. So in my role as strategy officer, I take my experience in a variety of settings throughout my career as a CEO, et cetera, and in really helping Mike and his team and the board synthesize the strategy for the organization going forward, looking at how we engage the community, the important work that goes along with that, looking at new business lines and opportunities, et cetera. And so it's just a real pleasure working with Mike and his senior leadership team to advance the cause of the work that we're doing here on Maui. So within the organization, we really look at what we do as improving the health and well-being of the county of Maui or the citizens or the communities in which we serve. That's really one of the core purposes of our organization as we move forward. We have heard over the last many months, I've been with Mike in a couple of community forums, specifically your journey to improved access to healthcare and services that you need here on the West Side. I have now experienced what it's like to be in gridlock, coming across 30, both ways. I get the alerts on my phone which talk about an accident that backs up traffic. And we've heard story after story of really the inability to access the appropriate care that we need here on West Maui. It's unfortunate, Joe, that what was originally planned for a community or a critical access hospital here on the West Side didn't, really pencil out and move forward. But we are absolutely committed as an organization in 2020 to have a presence of Maui Health System in standing up, at least as a first step, some form of an urgent care center with extended hours, to be staffed by physicians who are either board certified in emergency medicine or board certified in primary care medicine, et cetera. We will, either in partnership with existing players on the West Side, or if need be by ourselves, we will have a presence by the end of 2020. So Mike has made that absolutely clear. Hang on, just hang on. To start out with that. Sir.
There's a difference between urgent care and acute care.
There is.
Repeat it. 3 urgent cares on the west side and no acute care. What you're saying, just extended hours or a different level?
So let me finish the entire presentation piece, and then I think that will help answer your question. Okay? So we also know that transportation from the west side to the Central Valley can be a real challenge. Okay? And so we have stepped up our cooperation with county EMS in terms of land transportation, and then we've been in conversation with state EMS, county EMS, and AMR, which operates the land transportation ambulance and also the helicopter on the island, to improve air transportation service from the west side to Maui Memorial. So the helicopter does fly, we know that, when it's needed, but did you know that the helicopter doesn't fly at night on Maui? So why do you think that's the case? Nope, we have a place to land. Yeah, at the hospital. There is some question about where it should land, here on the west side. But one of the challenges that the helicopter has had.
Noise.
Noise also, but one of the challenges at Maui Memorial is there is a radio tower located about 800 feet from the hospital, and it's on the departure path, and it's not lit. And the reason it's not lit is because it does not have an FAA requirement to be lit because it's under 200 feet. It's 186 feet. So some air transportation consultants have said it's really not safe to take off from the helipad at the hospital because the departure path into the wind in that goes over the radio antenna. So that's been part of the reason why the helicopter doesn't really fly at night. So we decided we need to figure out why this is the case. We talked to Pacific Media Group, who we thought originally owned the tower. It's now actually owned by a national consortium called American Cellular Tower. We approached them, and they have been working with us since to get that tower lit. The FAA has signed off on lighting the tower. Air traffic control has signed off on lighting the tower. And we're working with American Cellular Tower to figure out the logistics and place a light on top of that radio tower. So within the next couple of months, we will then have the ability for the aircraft to land at night and take off from the hospital, which should begin to improve the ability to fly at night. There are some questions, and Senator Baker, maybe you can help us with this, of where the helicopter can land here on the west side at night, whether that's out by the airport, I think at, is it? Yep, Kapalua Airport, yeah, and that. And so whether that's a landing site or whether there can be other landing sites here. So we're moving to try to improve the air transportation service. We don't own that, but we're working on ensuring that that can move forward. So to the gentleman's question here, yes, there is a difference between acute care, which is usually applied to a hospital setting, right? And urgent care, which is really more, it can be convenient care, it can be emergent care, et cetera. But our initial thought is we need to have a presence here. We need to be connected to the community. We need to be ensuring that we offer choice in the community. And so our plan by the end of 2020 is to open an urgent care facility that's staffed by physicians with extended hours, okay, as a first step in the journey. The second strategic step that the organization is committed to, and some of you have heard the mayor's representative mention this, the mayor has mentioned this to the previous meetings of the Taxpayer Association, is a concept called a freestanding emergency department scenario. And Senator Baker, you sent some information to Mike Rembus a couple of months ago on that. Basically, a freestanding ED is literally what it means. It's a freestanding full-service emergency department that's operated 24/7, 24 hours a day, 7 days a week, 365 days a year. And it's run like an emergency department, and you have the appropriate and requisite ancillary services that go along with that, including imaging, laboratory, et cetera. So we believe that the future here for West Maui, absent of full-service hospital, which are very expensive to build and operate, I know, because I've operated hospitals that are critical access hospitals, et cetera. We think that solution is a 24/7 freestanding ED. That will take a little bit of time to put together. We would need to determine where such a facility would need to be sited, go through the appropriate certificate of need requests, and then there are sizable capital investments involved with that. We've had an analysis done that shows to just stand up the operation would take a minimum of $5 to $7 million. And so we would have to figure out, how do we do that? Do we do that by ourselves? Do we do that through a multi-stakeholder partnership? Is that a public-private partnership? Does it involve the state and or the county, et cetera? But we feel it needs to be more than just the health system doing that. The operating performance based on the size of the community, based on the changing volumes from the current ED to having an ED here, et cetera, is likely to generate an operating loss of about $2 million a year. That's preliminary estimates. Now, is that an insurmountable number? No. But as part of the planning and the process going forward, we'll need to figure out how best we do that from a health system and a partnership perspective going forward. But the overall analysis does show that there certainly is the capability and the ability to do a freestanding emergency department model. So that's our strategy. We think it'll take us several years to get to that, but we don't want to enter into just another planning process where we create expectation and hope, and then it falls through. So we feel the way to bridge that particular gap is that we actually come and start and have a presence in this community and become intricately tied to the planning, et cetera, going forward. And as I've shared with Joe many times, we also believe that community engagement is absolutely essential with this. We can't just do this alone. So we're looking at a multi-stakeholder type of partnership going forward. But we intend to be here with a presence by the end of 2020. That is going to happen one way or another. We are in conversations with some of the existing providers that are in the community as to whether they want to partner with us on that. But if that doesn't necessarily pan out, we're still coming. So that's a commitment we're making to the community tonight. We will have a presence. It will be a Maui Health presence. And then our strategy is to work more toward a freestanding emergency department concept, which then really gives you what you, I think, really want in terms of access, critical access for emergent care in the community. You are seeing a lot of small rural hospitals across the United States close, but many of them are also converting into freestanding emergency departments to receive patients, to stabilize, and eventually transport. And with freestanding emergency departments, you usually have the ability to hold a patient for anywhere from 24 to 48 hours sometimes before you either discharge them or transfer them. But that's what we're ultimately going to be working toward. And so the gentleman had asked the question what the difference was, again, between urgent care and acute care. Acute care is more inpatient focused in the hospital. A freestanding emergency department really takes up your capability to take care of patients in the long term, because that would include CT scanner, very possibly an MRI, but at a minimum a CT scanner and other modalities that are needed to support the operation. Be glad to answer any questions. Yes, ma'am.
Joe, we need to hear people.
Okay. So do you have another microphone, or are we just going to toggle? What are the extended hours? To be determined, right? To be determined yet, but if you were to ask me, I think extended hours are you're starting at 7, 8 in the morning and probably going to 9, 10, 11 o'clock at night. That's how I would view extended hours. When I ran a health system in Oregon, our clinics, we had urgent care clinics too with extended hours. That was kind of the time frame that we had.
Thank you.
Yep. Any other questions from the group? Yes, ma'am? I can repeat your question.
My question is, when you're considering locations, and I know you're new to the area, I believe all of our doctor's offices, medical clinics right now are within the tsunami range, which if we have a tsunami and people are trying to get care, those places would be closed.
So location is important.
Yeah,
Yeah, so,
is that being considered, or if you haven't?
yes, so the question was, when we are looking at potential locations, so this is the longer term strategy, right, for more of a freestanding entity. The rule of thumb in healthcare is when you build hospitals or what we call more fixed asset locations, you should be thinking that that location is secure and safe for 50 years. Okay, that's kind of the rule of thumb in healthcare. And so Joe and other members of the community, we've had multiple conversations with others. There are a lot of emerging opportunities for the placement of facility, but if we were going to invest the amount of money that we're doing, it needs to be in a location that can thrive minimum 25 years. But we should be thinking 50 years out. That's my healthcare planning thing hat on.
You might or might not be aware of this, but Doctors on Call is one of our urgent care facilities. They've been here for 20 years. They're open from 8 in the morning to 9 at night, 365 days a year. So my suggestion is, if you're actually going to add something to what we need for medical, you probably want to be open to midnight.
I'm sorry,
You
open?
probably want to be open to midnight.
Yeah, oh, yeah, sure. And again, I'm just kind of speaking off the cuff right now because I don't know exactly the hours of operation. But extended means really extended. You're closed for just a minimal amount of time. And again, remember, this is just the first step because we have to come and we have to demonstrate that we are committed to the community, which we are. Thank you.
Thank you.
All right.
Thank you, Jim. Thank you, Jim. Very important. The thing that's very important to know is that is huge. Okay, there's a commitment to come here and have a presence here, and who is going to have the presence with? Well, the same ones that are operating our hospital. So I mean, you couldn't ask for a better scenario, and I'm excited about that. I'm really excited about that because I know that once there's a commitment, and there is a commitment, that starts the ball rolling. And of course, things take time. It's got to be strategy. It's got to be location. And that's one of the things I'm also excited about. One of our presenters later is going to talk to about Pulilehua, because I kind of got my eyes on that as being an ideal, perfect spot by the airport as a location, and to work together with them. I just had a request by Pamela Eaton, who's with the County Planning Department. I'm a member of CPAC too. She's been working very hard on CPAC meetings. She's got another meeting tomorrow, and she's got a whole bunch of preparation for tomorrow's meetings that she's got to get done. And she's asked if she could be skipping the agenda to come up and do that now. And I said, of course, I'll do that, and I hope